Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Roark. Guys, I got a great one today with my good friend, Dr. Jules Benson. We are talking about trends and drivers for trust in 2026. And so Jules did a presentation at VMX, the largest vet conference in the world, and it was very much about what is going to make companies successful in vet medicine in 2026 when it comes to building trust with consumers. And so we dive into this. Obviously, I think trust is a super important component of practice. To me, when you talk about Uncharted, I always say trust is the cornerstone of Uncharted. It is about building and maintaining relationships with pet owners, and everything else works off of that. And so that's just how I focus on this. And so it's really fascinating to talk to Jules. And then we're talking about how trust is changing. Guys, the world is a different place, and the media is maybe not as on the side of veterinarians as it used to be. And we talk a lot about the perceptions of vet medicine as being a corporate place now, and how does that affect perception of trust and value. And anyway, we get into sort of relationship-centered care. I think it's a wonderful episode around understanding the industry and where it's going, and also talking about what we're saying to pet owners and what this looks like down in our clinics. And so Jules does just a fantastic job of painting a picture of large-scale industry trends and then tying them down to what those trends are actually looking like in the exam room. So, guys, I really like this episode a lot. I hope you'll enjoy it. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Jules Benson. How are you, my friend?
I am good. This voice is not me trying to out-masculine you. This is my new baritone. Just better than Andy. This is my post-VMX throat issue. Whatever plague we get after VMX is settled in my throat this year.
Yes, the conference plague. Yeah. Oh, man. I'm sorry you're a little bit under the weather. I'm really glad for you making time to be here with me. You and I are good friends. You are the founder of Tapetum Lucidum Consulting. You are one of the smartest guys in the industry. I really love your perspective. You and I, we had tacos together in Orlando at VMX, and we found ourselves in many of the same presentations and things. And so I always enjoy your perspective. My goal with having you here, I want to try to do sort of two things, and they're not going to work because it's going to explode out, and there's probably a multi-episode series coming out of this. But one, I kind of want to, there's a couple things I'm rolling around in my head after the conference around sort of where the industry is going and trends that I saw. And then two, at VMX, you were doing a presentation. You had a presentation called 5 Trends That Drive Trust and Value. And so I don't know if we'll get through all 5, but I'm looking at sort of access to care. I'm looking at how pet owners are looking at the vet industry. And I'm a huge believer that trust and the perception of value are absolutely vital if you want to be effective as a veterinarian and just to keep our industry healthy. Like, we need people to trust their veterinarian and to value what we do. And so I really think that the maintenance of trust and value, that importance can't be understated. And so let me go ahead. I'm going to get you to kind of walk me through a little bit what you did in the talk. And then I want to kind of talk it to it in, did your perception change at all coming out of this conference? Were there things you saw in the industry that either supported what you were saying or that are making you rethink kind of your position? So let's go ahead and start off. So talk to me about sort of who are the winners and losers with trust and value going forward.
So I think trust and, I think you're right. I think culturally, and we talked about this a little bit before recording, of like, we identify as veterinarians first, and as our actual day jobs most of the time second.
Yeah.
And I think inherent to being a veterinarian is that we feel like trust is just such an important part of our work. But I think the harder part that we have to wrestle with now is that it's actually become almost a commodity. Like, in order for us to show that we are providing value to our clients, we have to build that trust. We have to build that relationship. And you and I, and I've talked to Peter Weinstein and others about this, like, Peter's been a long time advocate of, like, the relationship comes first.
Yes.
And so I think that relationship-centered care, like, is absolutely vital now more than ever. And so I think immediately, when you talk about who is building better relationships, I think it's easier to do so when you are able to do the things you want to do, say the things you want to say, have the business you want to have. And so I think independent veterinarians probably have an advantage in being able to communicate trust or build trust, probably than our colleagues in corporate do. Is that fair, do you say?
I think so. I think so. I think that it's not an insurmountable advantage, but I do think that people still love the idea, especially if they're dealing with someone who's like, I own this practice. Like, this is I'm local and I'm here. I sense, and I don't have any metrics for this, I sense that sort of society is kind of starting to value that. You know what I mean? I think as everything kind of seems like it rolls up and private equity takes over more and more of these things, I think that there's some sentimentality around the mom and pop shop. And that's kind of what I think. I've long thought, and I've sort of told this to young vets, your clientele is the most valuable asset that you can have. And I think a lot of vets that look at the industry and think about what's happening here and here, you can get kind of sucked up in the big picture. I really think if you want to be a successful veterinarian, if you just really focus down on your clientele, which is that you called it relationship-centered care, which I love, is like just focus on your people and building those relationships and building that trust. And like, I have found that you can stay busy. I think, I don't know how the industry is going to go. I don't know if are we still going to have a pharmacy in 10 years, or is it going to be, all gone and we'll just be trying. But I don't think that largely affects you. If you have people who they want to come and see you, they have the relationship with you, they're willing to drive to see your face and to talk to you in person. I think that's the best job security you can have.
But I think there's another side to that. I think you can be a specialist, or you can be somebody who sees patients sporadically and still engage in relationship-centered care. And I think if people know what they're getting, if they're coming to see you for a TPLO or something else, and you and your staff make them feel like they're the most important people and their pet's the most important pet, and they build that even temporary relationship with you, that will show itself in whether it's reviews, whether it's word of mouth. Like, I think that relationship-centered care, it isn't just the continuity of care, which we talked about a little bit before, which is like, it's great to see the same, like, I don't know anywhere in human medicine that occurs anymore, but that's the old thing, right? That you would have a family doctor and you would see Dr. Warren every year from when you were born to when you were 23. And I think that we saw some research from the Royal College of Veterinary Surgeons, Knowledge, their nonprofit, in their contextualized care study that showed that people want things like continuity of care or these relationship centers. They see value in them.
Oh yeah, no, I think you're totally right. And I think to your point, I think treating people like they're the most important person that you can see. I think that's the work that you have to do that. And you never know who's going to become your dedicated, loyal client. You don't know who those people are. Yeah. And there's some people you can be amazing, and they're not looking for a committed relationship like that, or they're just not that into you like that. And so you have to treat everybody really well and look for that. But the flywheel in practice, as far as earning a living, but also in terms of enjoying practice, I think it comes after you've gotten those relationships going, and now you've got this dedicated group. When I started in practice, I quickly realized the most successful vets I work with were the ones who had most of their day full of people who had requested to see them specifically. And they were always like, when the rest of us got kind of a little light on appointments and we were kind of standing around, they were not standing around because they had people coming in. But the other thing is, my perception was that they enjoyed practice more because the people who came and wanted to see them really cared about what they thought and took their advice very seriously. I mean, they did everything the doc recommended, but I think that they probably had much greater compliance, which is not about revenue. It's about enjoying your job and feeling like people are following your advice. And so anyway, I'm completely on board with this focus on sort of that relationship-centered care.
And I think a lot of that comes from, and one of the points I talked about was this value-based authenticity. I shared this post from the software company Epic, the human electronic medical records company.
Yeah.
And this was posted by Graham Walker, who's an MD. He said he was touring Epic and he was in the bathroom, and there were these 3 pieces of paper in the wall which had our 10 commandments, our principles, and principles of our community. Okay. And there were they were bold statements. Like the first one on 10 commandments was do not go public, and the second one was do not acquire or be acquired. Like, these are big, like, stakes in the sand. Like, this is to do those things or to not do those things. It's a big deal. And so I think when kind of the outcome of that post was like, what you put up with is what you stand for. And I think that's the value. And you talk to our friend Phil Richmond a lot about this, like the culture and the authenticity within the practice communicates itself down to the value level, or the perceived value level of the consumer. And so I think again, when you talk about winners and losers, do you sit in your practice and you feel that whatever values are on your wall or in your handbook, if you feel you're living those values, you will go to battle for that practice in more ways than you would think about, right?
Yeah. Do you agree with the idea that when you look at the practice groups that are really growing quickly, not through acquisition, but the ones that are really coming up, like I'm thinking of like Pet Folk, I'm thinking about Thrive, I think Veg a couple of years ago, they really seem to very much stick a flag in the sand around their values. And at least I saw that from the outside, and they really seem to have a strong opinion about medicine and who they were. And it's not an endorsement of any of them, but it's just looking at sort of where are these companies coming from? And they are growing fast, and they have been very successful in their sort of growth across, the US at least. Would you agree that that type of value-based approach is required if you want to build something that's going to really grow at scale in vet medicine today?
I would go so far as to say I think it's essential wherever you are in vet medicine. I think if you're a general practice and you are trying to attract or keep, and you and I both speak to a lot of students, I think if you're trying to attract and keep veterinarians or any member of the veterinary healthcare team, we know it's even harder to fill some of those other spots, frankly. I think having that authentic value-based approach to your team is essential. So yes, I think corporate have a harder time because I think they're in a tougher spot now, right? Like there's some negative association with corporate veterinary medicine, whether that's warranted or not. And we know the data are sparse on the ground, but we know there's a lot of people out there yelling that corporate or large groups doing the work, or however you want to put it. So I think they have a higher bar to leap over, but I think it's essential for everybody. And if you don't have a true value-based authenticity within your practice, I think it's a huge opportunity.
Yeah. Talk to me a little bit about sort of an evidence leveraged approach to building trust. And so one of the things that I most admire about you is I talk to a lot of people about spectrum of care. And one of the things I think that you've done particularly well is because of your training as a doctor, I think you're actually looking at like, how does this approach to spectrum care actually translate to what we do differently in the exam room? And it's not just sort of hand waving and you should say more of this or that, but you really do a good job of sort of looking at what does the evidence say about what our outcomes are going to be if we take more conservative approaches and things like that. So, I find a lot of what you've written on that to be really useful. And it helps me to feel confident in offering pet owners options and feeling good about, this is not me cutting corners. This is me looking at the evidence and say, look, this is the outcome that that we can sort of expect. These are our probabilities if we do a more conservative approach to a more aggressive. And again, I know you think a lot about that stuff. Talk to me sort of about the use of evidence in your mind to build sort of trust with the populace.
First of all, thanks. And I would certainly give at least equal props to my frequent co-author and co-conspirator, Dr. Emily Tincher, on this, who you also know well. We've talked a lot about this, and Emily still talks a lot about this with her work with Nationwide. But I think when you start to ask rooms full of people and say, okay, and the CSU Parvo protocol is a great example, right? So how many of you in the room know the CSU Parvo protocol? And a few hands will go up and you say, okay, if intensive care for a Parvo puppy results in a 90%, positive clinical resolution, where do you think an aggressive outpatient therapy gets you? Like, what are the positive outcomes? And everyone always underguesses because it's 80%.
Right.
You can do intensive inpatient therapy with Parvo, and that racks up, let's say $3,000 to $10,000, depending on the severity and where you are. Or you can do, outpatient therapy where you still have the pet has to come in every day, has to be monitored, and if it's going poorly, they will recommend intensive care. But you could do that for maybe less than $1,000 in some cases. And the difference between those two is 10% of, positive outcomes. Not nothing. Like, again, put that into puppies. For every 10 pets you see, if you went, intensive versus non-intensive, that would be one dog that wouldn't make it. I think one of the biggest problems we have around effectively practicing a spectrum of care is that we have a dearth of evidence, or we have a dearth of availability or accessibility to those evidences.
Right.
When we think about what do I know in practice, and we talked about this when we were using the Nationwide data, like I think I saw, for those rare breeds, whether it's a Basenji or like some of these other things that you just don't see that many of, how are you supposed to make really good evidence-based judgments about what that pet could have, or if you've only seen 3 of them in your career?
Yeah.
You have to go somewhere else to find that evidence. And I think there's some really good evidence-based care out there around the middle ground. Because right now, where's the evidence? It's on the higher end of care. It's on the most advanced level of care, saying, okay, if you're doing a TPLO, or if you're going to go to a referral center for a GDV or whatever, I was like, that's where our evidence is.
Yeah.
I think in order for us to build trust, especially at general practice level, I think it's essential that we generate more evidence and make those evidences more available.
All right. So we've talked about this before, you and I, in that, the way the system is set up, the research around, outcomes of care are generally funded and put forward by people who are rolling out new medications and new things that they would add on top of our current standard to improve it. And they have a vested interest in doing this research and showing that their product or their approach improves outcomes. And so as a result, there's a lot of focus on, hey, look, we can raise the standard of care. We can get a better outcome with this.
Yeah.
It's hard. Where does the
and even the visibility of those things, to your point, like those are things that get put in front of you in the practice because they're helping them sell a product. And again, there's no evil empire here. This is just commerce.
Yeah. Oh, you're exactly right. And like the research becomes the marketing, and they're sort of tied together, and so it's very visible. So one, I think sort of going back to you and to Dr. Tincher as well. Like I think you guys have done a great service for the profession in terms of digging and saying, hey guys, this study didn't get a lot of attention, and kind of pulling it out. And so I think that's great value and service that you guys have done for all of us. And also, are you optimistic that this kind of like, where is this research support going to come from? I mean, we're living in an America where research dollars have been cut down sort of again and again in recent years. And so, I mean, I don't know. Are you optimistic that we can continue to see this kind of research? And if so, who's going to do it and where does it come from?
So I'm not an optimistic person generally.
No, you're
as
not.
You know, I'm a little on the cynical side. I am moderately optimistic.
That's saying something.
It is saying something. And I think it's because of spectrum of care. Like I think when people talk about spectrum of care, there's a lot of like, oh, it's this one fluffy thing and it makes people feel good. And I'm like, no, I think it's the future of our profession, and sustainability of our profession is by practicing a spectrum of care, which means using evidence-based medicine, which means more and more people will see the value in either generating those data. And so I'll call out now, ASPCA does an amazing job of this. Yeah. Many universities, like Emily McCobb, who is the PetSmart Charities Endowed Chair at Davis, I just got the chance to talk to her at VMX and just thrilled by some of the things that she's approaching, which won't be necessarily popular with some companies, but will give us so much more information to talk about. And I think as a marketer, I think it's great to be able to say, like, here's one thing and here's another thing. Like, try and find the secret in that to like, I think it makes you better at your job. So all the people who are currently not sailing on like, this is the only evidence base we have, I think once we start generating more things, they'll have more fun as well. But I think there's more. I think that we're starting to see the cracks in some of this around the availability of evidence. And I want to speak very briefly about UpToDate and Open Evidence, which are human healthcare programs, which allow people to access the most up-to-date information. I think, and again, I don't have any endorsement or any association with any of these companies, but like, I think the work that Caleb and his team are doing at Instinct, Dr. Caleb Frankel, I think that the work they're starting to do with standards, and I've talked to him and his team as well. And I think that is the vision they have. Like, how do we embed evidence-based into the way that you work, into your workflow, so that when you're treating a pancreatitis patient, you can pull up the most recent evidence of this, saying like, okay, if you want to go full bore, there's a 95% chance of resolution. But if you want to do these things, then you're going to give up 15, 20 points of resolution, but it's going to be at this cost. So like, I'm starting to see some of those things. And I'm also starting to see, like, I think I've talked about this before with you, the Royal College of Veterinary Surgeons knowledge. So that RCVS knowledge is the non-profit associated with the Royal College of Veterinary Surgeons, which is the regulatory body in the UK. Okay. They have the Canine Cruciate Registry, which is basically the opportunity for everyone in the UK who is doing a cruciate ligament surgery to submit their surgical report, what techniques they use, what experience does the doctor have, as well as enroll the patient in client-reported outcome measures. So how is the patient doing ongoing, how they feel about the mobility and the pain scoring, and really generating not just medical outcomes, but real-world evidence of how people feel about them, how they feel their pets are doing based on their expectations. I see that as like, that to me is the incredible dream of what we can do with real-world evidence in veterinary medicine. And then the other thing I would say is, like, we start to see companies like Point of Health, who John Ayres recently invested in, and they're basically saying, hey, we will show you what the outcome, the consequences of doing or not doing something are based on the available evidence. If you have a 7-year-old golden retriever and you don't do a dental, these are the downstream things that we see associated with those data. If you do a dental, hey, you're going to avoid this disease, that disease, the other. Like, so being able to actually show, and I think to a client, this is an evidence base. This is based on data of of the value you're receiving when we recommend a procedure. I think that's an incredible value to practice.
I mean, I think that's fantastic. Are you so? I mean, I love that we can look at the sort of the cruciate log of the UK.
Yeah.
But I mean, do you see potential to set up something like your example with dentistry? How phenomenal would that be for me to be able to say to the person? I saw a dog day before yesterday that had it was a little Pekingese, and it had it was 4 years old and already had the thick dental tartar and the gingivitis that you would expect in a 4-year-old Pekingese. And so I said to him, "Hey, look, this is going to be a thing," and I could tell they kind of listened, and they kind of didn't. In their mind, this is still a puppy, and I'm like, hey, just think about this. It was
and we can also
awesome
say. We could also say, hey, we think there's a risk of kidney or cardiac disease, but be able to show them the numbers and say, this is what it means in terms of it. And we've seen that in the studies of obesity impacts. The most impactful conversations are about longevity.
Yes. Yeah.
Right. We have good studies on that. Like that. So in the same way, we say, okay, these are the downstream effects directly based on this intervention that I'm recommending.
So you're on this is about the biggest wave of optimism that I've gotten out of you in a long time. So I'm going to let you end here, either going back to your cynical roots or riding this a little bit farther. Are you optimistic that we'll see something like this, some sort of a data registry like this, that we can start to gather this information and start to present it in the near future in veterinary medicine?
I think so. I think we have the tools now more than we ever have. And we talk about, I've been when we talked about interoperability, which has been a favorite topic of mine for the past decade, maybe. Interoperability, very briefly, is the ability for data systems to transfer information between themselves congruently, right? So if you're recording body condition score in one system, to be able to translate it to whatever out of 5 or out of 9 system in another one. So to basically have that ability to transfer records and not lose the information. We are living in a world now where interoperability has become less of a barrier because of our use of technology. So I think the biggest barriers to us having greater evidence base is our collection of data within the clinical setting, and then what's happening at home. And so, I'm working with some friends at the moment to try and look at that. It's like, what would it mean to really use instruments that would collect information at home that could be validated, that could be used in clinical research? And so I think we have the technology gives us the tools to do the things that we have wanted to do for many years. So I'm more optimistic than I've ever been. Yes.
I don't think it's going to get any better than that. I think we're gonna leave this here. Dr. Jules Benson, where can people find you online? Where can they keep up with what you're doing?
I've been very remiss on LinkedIn, but that's where I do most of my brain farting these days. So if people want to follow me on LinkedIn, they can go for that.
That sounds good. Well, I'll put a link in the show notes. Thanks for being here, my friend. Thanks for tuning in, everybody. Take care of yourselves, gang. And that's what I got. Guys, thanks for being here. Thanks to Dr. Jules Benson for being here. I hope you guys enjoyed it. Boy, I always leave conversations with Jules just thinking about what the future looks like. It's rare to have him leave in just an optimistic, positive state of mind. I think that means something. I think it's like when the groundhog comes up and sees his shadow. When Jules comes up and sees some positivity, I'm like, this means something. It means winter is almost over. That's what I think it means. Anyway, gang, this has been super fun. Take care of yourselves, everybody. I'll talk to you later.